the things that I'm going to very briefly cover today is, first of all, what is the function or the functions of sleep? And then of great relevance is what is its association with diabetes? How do I know if I have a problem with my sleep? And equally importantly, where do I go to get help? So obviously the first thing to say is that sleep is important. In fact, you can survive much longer without food than you can without sleep. So there have been case reports of individuals surviving for up to 2 months without any food. Without water, obviously, it's much more difficult, about 3 to 5 days. But actually, without sleep, we think that probably you can go somewhere in the region of about 15 days without any sleep before you die. So that's significantly shorter than you would survive without food. And it's also important to stress that over an 85-year lifespan, we spend about a third of our lives asleep. And if you compare that to the 10 to 11% of the time that we eat and drink, or the 1% of the time that we exercise, it's amazing that we don't focus more on this behavior that we undertake or try to undertake for a third of our lives, because clearly if we're doing it for a third of our lives, it must be of relevance to what we're doing. So why do we sleep? Well, it's true to say that to date, we don't really fully understand all the functions of sleep. We know that pretty much all mammals, and indeed all animals, do it. All animals have a sleep-wake cycle. And it must be pretty important because there are some animals that manage to sleep with only one half of their brain at a time. So it suggests that actually nature has deemed this so important that it allows animals to be awake and asleep at the same time. And in fact, there are many animals that do this, including whales and dolphins and seals. It's very common in birds. There are some birds that can fly at the same time as sleeping. And even insects, very basic insects like fruit flies, exhibit some sleep-like behavior. In fact, sleep is so fundamental to life on Earth that even if you take a single cell from one of your bodies and put it in a petri dish, in a little dish, and culture it, then that cell will continue to exhibit patterns of activity over a 24-hour cycle that really replicate our circadian rhythm, our 24-hour cycle. So this is something that is at the very core of life itself. But what is it actually for? Well, there are a number of theories, and it's important to stress that these are still theories, that actually none of these have been definitively proven. A lot of these theories tend to be about energy conservation. So the fact is that, whilst we're asleep, we are utilizing less calories, we need to spend less time foraging for food, and that is protective. But actually in mammals, and particularly in humans, there is a great deal of evidence that it's responsible for maintenance of our brain, for maintenance of our memory, of learning. And indeed, more recently, we also understand that during sleep, one of the major activities that occurs is that channels within the brain called the glymphatic system open up and help us cleanse toxins or chemicals that have built up over the course of the day out of our brains. And it's out of this system that we now understand that there is probably a strong association between sleep and cognition, and sleep and things like Alzheimer's disease. So this is the typical pattern of sleep. It's important to understand that sleep is not just one brain state, that actually it's a series of brain states through which we progress over the course of the night. We start off at wake and then go into very deep sleep and into REM sleep, which is typically termed dreaming sleep. And this is what tends to happen over the course of the night with 4 or 5 of these cycles. But actually, in a normal state of affairs, it's not quite as clear cut as that. So what is normal? Well, I think that one of the things that we know is that if you sleep too long, your risk of lots of conditions increases. And perhaps the most important condition is death. So that if you sleep more than about 9 hours a night, then that is a relatively strong marker of increased mortality. Now, of course, it's different from saying that if you sleep too much, you will die early, but it suggests that there are certain conditions that cause you to sleep longer that might increase your mortality as well. And if one looks at sleeping too little, so these are a number of different studies, many studies, with a combined sample size of well over 1 million individuals that show that if you sleep less than about 6 or 7 hours, that increases your risk of mortality as well. And in fact, it's not just mortality that is affected by sleep deprivation, we know that there are a huge range of changes to our behavior, such as personality changes, mood, levels of depression or anxiety, your ability to function and to perform complex tasks, but also a whole range of bodily functions like your immune response, your respiratory function, your blood pressure, and your risk of cardiovascular disease or heart rhythm abnormalities, as well as things like your pain levels and decreased and your likelihood to develop seizures or migraines. So this really suggests that actually sleep affects nearly every aspect of the human system. So what about diabetes? So obviously this is why we're here, because this is a diabetes group. Well, is there any link between sleep and type 1 and indeed type 2 diabetes? Well, we know that sleep restriction causes people to put on weight. It increases the risk of obesity. And one of the ways it seems to do that is that we know that there are two different hormones, the major one being leptin and another one called ghrelin, which influence both our appetite and how we metabolize food. So leptin in particular is thought to be important. It's a hormone that influences our how sated, how satisfied we feel with food. And if one is sleep restricted, then levels of leptin go down, which means that we are less likely to be sated by the food that we're eating. And as a result, sleep restriction results in an increase in hunger and an increase in appetite. And in fact, some studies have suggested that after a brief period of sleep restriction, the amount of calories that people consume can go up by about 40%. So you can begin to understand why sleep restriction may give rise to weight gain. And in fact, in this study, which looked at a very large number of nurses between over about 16 years, what they demonstrated was for those nurses who slept 5 or 6 hours, they first of all started at a higher weight, and they put on much more weight than nurses who slept for 7, 8, or 9 hours, suggesting a clear correlation between sleep duration and how much weight we put on. We also know that if you're sleep restricted for a single night, that worsens your glucose tolerance, so how well your body processes glucose. So even a brief period of sleep restriction results in dramatic changes to how sensitive your body is to insulin and how much insulin is produced in response to glucose. And this is not just one study, this is multiple studies. And indeed, if you disrupt your sleep for any other reason, and there are many other reasons why sleep might be disrupted, particularly if you disrupt deep sleep, which is sometimes termed stage 3 or N3 sleep, that has very similar effects on your glucose tolerance and on your insulin sensitivity. So it may actually worsen your diabetic control if you are sleeping poorly or your sleep is disrupted. Can you improve your diabetes by improving your sleep? Well, certainly there is some evidence for that, in that individuals who were overweight, who were asked to extend their sleep, demonstrated a marked reduction in their overall appetite and an even more dramatic decrease in their desire for sweet and salty foods. There is good evidence that if you ask people to go on a diet to lose weight and you improve their sleep at the same time, weight loss is more successful. And that if you improve your sleep, then even after a few days, the way you metabolize glucose and the sensitivity of your body to insulin improves as well. Unfortunately, there are no consistent results with drugs to improve sleep, and much of this is about behavioral measures. So other influence of sleep, well, we know that sleep, and this is of particular relevance to people with diabetes, is that sleep disruption increases your blood pressure, increases your risk of cardiovascular disease and kidney disease, and there are other associations between poor sleep and poor health. So how do you recognize whether or not you've got a problem? Well, the first question is, are you sleepy? So this is something called an Epworth score, which is a measure of how sleepy you actually are. It asks you whether or not you would be likely to doze off in these 8 scenarios. And the average score for this, if you're very quick at mental arithmetic, is about 6. If your score is 10 or more, then it suggests that it's abnormal. And if your score is 10 or more, it suggests that you have a biological problem with your sleep. If it's 0, it suggests that you've got insomnia. If you're an individual who is not likely to sleep in any circumstances, then it very strongly suggests that you've got insomnia rather than a biological sleep problem. So what are the sorts of biological sleep problems that we see? Well, the biggest issue is sleep apnea, which is very loud snoring, where individuals block off their airway overnight, and that disrupts the quality of their sleep. There are other conditions like restless leg syndrome, which is very frequently seen in people with diabetic nerve problems. And then the things that cause a low Epworth score, a lack of sleepiness during the day, is standard insomnia, and perhaps individuals who are burning the candle at both ends. So if you find yourself at one of those extremes in terms of the Epworth score, then it is worth having a discussion with your GP. There may be some tests that are required. You may be required to be seen in a sleep lab. Or actually, if you've just got insomnia, there are non-drug-based treatments, like a treatment called cognitive behavioral therapy for insomnia, which is widely available on the NHS now and is available using online services. These include things like Sleep Station and Sleepio, which can be given to you free by your GP to try and get your sleep back on track if you do have insomnia. If your GP suspects that you've got a sleep disorder, then it is worth being sent to a sleep clinic, particularly to look for sleep apnea, which is associated with a range of very poor sleep health, poor general health outcomes. And there are plenty of books out there that can give you some further information about sleep disorders.